Yeah. I vividly remember about the time of the COVID-19. Yeah, COVID-19. Yeah, I've suffered to the
Yeah.
COVID. Yeah, and from then and to now, I don't. Yeah,
That's
lucky me.
really good. That's really good. So you can say that once in a blue moon, and that's perfect.
Yeah,
So
one.
once in a blue moon, you know that's very rarely. So that's perfect. And so you can say that you are in good health. So you are in good health when you want to say that I'm healthy. So for example, when you're asked about your health, so physical or mental, of course, so you can say I'm in good health or I'm perfectly healthy.
Yeah.
So that's perfect. Healthy or I'm in good health. Okay. Well, and tell me, Helen, which one is more important, you think? Physical health or mental health?
Yeah, I think both. Yeah, but if I have to choose, I would choose uh, 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 um, mental health. Yeah,
Of course,
because
that's really,
it will decide all the things. Yeah, we
yeah,
have.
of course, it affects, yeah, all sides of our life. Like, for example, yeah, our physical health, of course. So we need to, so if you had to choose, you would go for mental health. Of course, both are really important. So, of course, as you said, we need to look after. So, look after our mental health to maintain our physical health. So both are really important. Well, okay, so what do you do? What do you do to stay healthy? Stay in shape,
Yeah,
healthy.
stay healthy. First, I have to balance my life between work and life. Yeah,
Yeah, of
and
course.
uh, I need to focus to my meal, every meal in the day. Yeah, by taking the good food and the good drink, and if I so busy, but I will keep to work out um, at least 30 minutes per day to keep
Oh,
my to keep my mental health better. Yeah,
yeah,
when I do exercise, and I think um, I will feel much better. Yeah,
of
much
course, of
better, and
course.
I fall asleep and do nothing.
Of course, very good. So workout and eating a healthy diet.
Yeah, a healthy diet,
As
and
you, yeah.
um if I have some free time, I will listen to the music. Yeah, some instrument instrumental music. Yeah,
Instrumental music, of course, like chill out,
yeah.
relaxing. So I know, and it's perfect. So how about doing yoga? Have you ever done, or so what do you
Yeah,
think about it?
yeah. I've done yoga for uh, 3 years in the past.
Ah,
Yeah, after I give birth, and during the COVID time, because I joined yoga class online, and
yeah, of
yeah,
course.
I
Yeah.
yoga every morning. But the uh, the the year later, yeah, a bit nowadays. I don't do yoga because I love to jogging or exercise, to do exercise or jogging or walking around my
Yeah, more
apartment.
active.
Because
Yeah,
I
I know.
to listen to the postcard. I think yeah.
Yeah, of course, more active uh exercise like jogging. So you like just decide whether you want to use two or I, and just I like jogging, or two is extra here because you are using ing form of verb. So of course I do agree with you. It's like sometimes it's really perfect actually listening to music, relaxing, and doing meditation, doing yoga is perfect. Actually something like I don't know, it's like pure your soul. But sometimes I feel like, I feel sleepy. I'm not the one for yoga, I think so. I need to be more dynamic, active, dynamic. So, but it's perfect. Of course, I do agree. And I think it's really important. Well, okay. So today we're going to talk about health and disease. Okay. So let's have a look at a first word of the session that is, oh, yeah, fever. So tell me about your symptoms when you have cold. So what symptoms do you normally have?
Yeah. That's it. I feel sleepy and don't want to do anything, but lay down on the couch. And yeah,
Yeah,
sometimes I have a fever or cold, or um, I don't want to eat. Yeah.
yeah, of course. And so do you normally go to doctor or no, just stay home and rest?
Yeah. Um, I need to to reflect myself. I need to check everything is if it is okay, and I think is normal. So I will give it some time to pass over. Yeah.
Yeah.
But if there is something wrong, I can feel it clearly. So I will um, promptly go to see the doctor.
Yeah, of course, of course. Well, so just let me say something about the word the verb. You said lay down or lie down. So which one?
Yeah, I say
Because
that
they're
I lay
different.
down.
Yeah, of course, because I was thinking that, if I heard correctly or no. So, in this case, especially for example, we say lay down on the couch or lie down on the couch. For example, I went to lie down on the couch. Okay, so lie doesn't have a direct object. So lie is the correct verb to use in that case. Okay,
Yeah.
so you can say, for example, I went to lay book down on the couch. So here, because you actually, it has a direct object. What? A book. So lie down for you, I lie down, but lay down something on the couch. So you can, for example, lay down books on the couch.
Yeah,
Okay.
yeah,
Yeah.
thank you.
Okay. So here, lie down.
Okay.
Well, so the first symptom, so we're going to talk about symptoms of cold. So fever, sign, symptom, okay, is the first one. Okay. And yeah, we normally have, especially about kids, it's really difficult. So when they have cold or flu, so fever, I think I didn't know the most horrible part of cold. So I remember, especially when they're babies, it's really, I know, scary. When we feel like a high temperature, it's really scary. Well, okay. And runny nose. So when you have cold, do you have runny nose?
Yeah. Yeah, well, yeah, of course, runny nose.
Oh, of course. Yeah, so let me ask you another question. So we talked about physical health and, of course, I'm not actually talking about mental health. Now about physical health. So you know that some people try to keep healthy by taking medicine and taking some supplement. Do you agree with this?
Um, I don't prefer to take medicine.
Yeah, of course. So like
Yeah,
vitamins, yeah,
yeah,
no supplements, nothing.
yeah, but I will follow the doctor advice.
Of course, of course, of course. So of course you need to follow. So it's like, you know, you get prescription from doctor and then you go to pharmacy and you can buy. Well, and so stuffy nose. So how about this one? Do you have any idea about this? So of course it's really difficult, like, you know, you can't breathe. And I think it can be one of the most, I don't know, difficult part of cold, especially like, you know, feeling of fullness in your nose, stuffy nose, especially it happens like, you know, when you have cold. So the word have can be used for symptoms like I have stuffy nose, okay, and it's really difficult to breathe. So when I'm having cold, so stuffy nose. Okay, tell me about your methods in your country. So, for example, not in some I didn't like cases like, for example, cold. That is not really important. So, would you normally prefer to go to doctor and, for example, take some medicines, okay? Or no, just, you know, people would prefer to stay home and follow some traditional methods, like, you know,
Yeah,
I don't know, some herbs or something like this.
yeah. You know, we usually use the methods of uh, water steam, water
Oh,
steam with earth or some kind of leaf. Uh,
like
and
herbs.
yeah, to and make it in steam water, in boil
Oh,
water, and
oh,
we relax in the water atmosphere, and then we will feel better with the stuffy nose.
yeah, of course. Yeah, of course. Yeah, it's like, you know, and so so it's like no medicine, you mean?
Yeah, not no medicine, and almost the time I will feel better after doing that.
Yeah, of course. Actually, it's really good. So I do agree with you, like, you know, breathing, just, you know, breathing in steam
I,
from
yeah,
heated,
it
breathing
is.
in. Yeah, of
Yeah,
course, the preposition is, yeah, breathe it, yeah, of course, in steam from heated, yeah, for example, heated water, it's really good one, especially so when you have stuffy nose, I think it's perfect, yeah. Well, and oh, sore throat. Yeah. So a cup of warm water would definitely do good. Yeah, really, it's good. Actually, yeah, it's good. But at the moment, so what do you think about this? So at the moment, it's good. So sore throat. So what do you normally do when you have sore throat?
yeah. First of all, I will um, clean my throat with salted water. Yeah, and I do it many times per day, and uh, and all the time if I have any symptom about the flu, I will drink a lot of liquid, a lot of water or
Juice.
fruit juice. Yeah,
Of course.
with vitamin C, and I think it's work.
Yeah, I think so. I think so. Yeah, of course. Well, so, and how about your kids? So, for example, when they have cold, so what you normally so just, you know, let them stay home and, you know, rest, or so what do you do?
Yeah, if they have the symptom is serious, I will let them to stay at home and rest. Um, and I will take them out to go out, yeah, in the sunlight, and
Oh,
do some jogging or something funny, uh, and I find that they will get better soon. Yeah. uh,
ah,
yeah. If I let them stay at home or watch TV or something like that, I think that it,
that,
that
I think that
yeah,
that's
the
really
center
perfect.
is
Of course. So actually, you grab their attention from cold.
yeah.
That's really good. Of course, that's really good.
Yeah,
Wow.
but if the symptom is worse, yeah, I will take them to the doctor. Yeah.
Yeah, of course, of course. Well, yeah, of course. And so let's keep going. Food poisoning. So street food is one of the main causes of food poisoning. So really? So is
Yeah,
it true?
yeah, it's true because our food industry or in the food is not good if you don't know how to choose good
Uh,
food, yeah, to eat. So it is the main cause of a poison, food poison in Vietnam.
oh, of course, food poisonings. Oh, of course. So street food. Actually, I think, they need to be really, so street food is really important because people tend to buy. It's like, I don't know, it's really good to go to street and I don't know, buy something to eat, like snack or something like this. But, it's really important if they are healthy. So like this, especially because of, for example, in uh, some summer or for example, hot season, it's difficult to actually keep them for a long time outside. So maybe it's really dangerous, especially for kids. Well, and are you allergic to something?
Yeah, I am allergic to dust.
Ah,
Dust. Yeah,
ah,
and some flower. Yeah.
so some flowers. And do you take medicine to
Uh,
avoid?
yeah. I will take medicines. Yeah, some
Yeah,
kind
and
of
it gives
medicine to stop
uh,
the symptom.
and it gives you stuffy nose or runny nose.
I get some red
Each.
dot in
Ah, of
my skin.
course, of course. So it causes your skin to itch.
Yeah, it
Yeah, become red, of course. I know. So because when we are allergic to something, especially dust allergies, give many people like stuffy nose or runny nose, or actually they cause the eyes to itch and become red. So yeah, it's just really
yeah,
difficult.
I don't have that symptom,
Oh,
but I
perfect.
have some red dot.
Yeah, perfect. So it's good. Actually a good point that you don't have these symptoms, so that's really good. Well, and so let's keep going. So you can be the verb, just let me that the verb be can be used for allergic. So you are allergic to something that is caused or it gives you. For example, dust allergy gives you, okay, something like, for example, itchy eyes or stuffy nose or something like this. You can use this way. Okay, throw up, vomit. Informally, we say puke. Puke means vomit. Informally, we say puke. So tell me about your pregnancy, or so tell me about, for example, I don't know, some people are travel sick, so because of this they can't travel, especially by car. So like they feel like puke or to throw up something. So I like this. So do you have?
Yeah, I just have the, throw up in my pregnancy. Pregnant in the past.
So yeah, yeah, of course, like especially first month.
Yeah,
So yeah, you felt like puked a lot.
yeah,
Yeah. So you,
terrible.
yeah, of course I do. Of course I know. Of course I know. So about travel sickness. So you are not travel
No,
sick, no?
no.
Okay, that's perfect. Okay. Well, it's really difficult to travel with someone who is,
Yeah, that's right.
because, they really suffer and that's really difficult to control. So, well, so throw up or vomit or puke. So if you heard this word, all of them are the same. Just, informally we use puke, okay? And so tell me about painkillers. So in your country, can you buy painkillers without doctor's prescription?
Yeah, that's right. It's
Oh,
very easy to buy. Yeah, it's
oh,
different in quite different with the
oh.
in the US. Yeah,
So,
we can buy it
oh,
uh, anytime we want.
yeah, so I need to travel to country to get buy some painkillers. Of course,
Yeah,
it's
it's very
legal.
easy and
It's
cheap.
legal to take them. But yeah, that's really so you can easily go and buy them without prescription.
That's
Wow,
right.
that's really good. Yeah. So, okay, tell me about headache. So, if you have headache, so you think it's better to take painkillers and sleep, or no, just go to and darken your room and stay, just try to sleep, close your eyes, or I don't know, some other method. So, which one would you prefer?
Yeah, I prefer to choose the second one. Yeah,
The
I don't like to take medicine at yeah, and I will. I'm not choose to take medicine.
yeah.
If I have a headache, I just want to just have some sleep or to relax. Yeah,
Yeah,
and if I don't, I can get over. I will take
yeah.
medicine.
Of course, of course. And tell me about a healthy lifestyle because we discussed it. So I want to know, what does a healthy lifestyle mean to you?
Yeah, I think it's very important for a person. And I, uh, I always keep myself healthy with the mental and physical health. Mm, and if I keep my spirit good, I will I will feel happy and do anything and can enjoy my life. Yeah.
Yeah,
So I think it's very important.
okay. And what do you do to do it? So how is a healthy lifestyle? So what do you do to have a healthy lifestyle? So of course you do some exercise. So what about, or healthy food? But some people believe that, cleaning or for example, having schedule or for example, having to-do list or self-care. So all of them are part of a healthy lifestyle. Do you agree?
For me, I think that uh, I, I I love freedom life. Yeah, in freedom in whatever I want to do in
Ah,
my life, and I have uh, um, a finance status. Yeah,
yeah,
and I will feel happy. Yeah, that's all.
yeah, of course. Happiness, like, because we had a topic about money and happiness, and of course, we have an idiom that okay, money doesn't bring money. Of course, it brings happiness. Of course, money brings happiness. So when you have money, what you can do when you are independent, so you have an independent lifestyle. That
Yeah,
is really good. So having, free human independent lifestyle, and that's really good, of course. So when you can do whatever you want, and you need to, of course, you can, and about your spirit, you said something, you said that I try to have my spirit good or something like this, but you should say, I try to keep my spirit high. So which means to be extremely happy. So keep your spirit high is the phrase that you can use. Keep your spirit high.
Yes.
Wow. It means be happy, extremely happy, of course, and motivated. Well, and so you know this word, so we're not going to talk about it, of course, antibiotics. So yeah, of course, overuse. And now, unfortunately, nowadays, of course, no, they can't be overused because, you know, we are not allowed to use them. Just, you know, uh, when doctor orders something, of course, we can say, okay, and but you know, it's. Is it really common in your country to actually take antibiotics for any illnesses?
Uh, yeah. And I said before, we are easy to buy medicine, and some normal kind of an antibiotic.
Uh,
We can buy it easily in the pharmacy, but some special kind of antibiotic we can't buy. But
and
if we have the doctor, yeah,
yeah,
the doctor
and
advice to
do you
buy.
think, yeah, do you think buying or selling medicine, so any kind of antibiotic or I don't know, all the kind of painkillers should be banned without prescription, of course?
Mm, yeah, I don't know. I think that the, the government will do anything to help the people. Yeah,
Yeah, of course, because you know, it's like can be dangerous. Even supplements, we know that, you know, for
that's right.
example,
Yeah,
yeah, overuse
yeah,
of
I
supplements can be
totally
really
agree.
dangerous. Of
Yeah,
course, so it's really important, you know, to have a prescription. So as you said, doctor, so it's like a prescription is an order written by doctor so that we get
yes.
and we of course get our medicine. So that's really important. Well, and so we have some words here and phrases so about illnesses. So all of them are easy and you know how to use them. Just do you have any questions related to these words and phrases?
Yeah, no.
Okay, well, so let's keep going. Be or get back on my feet. So of course you can guess. So to become healthy again. So especially after a period of illness, so when you're back or you get back on your feet, it means that you are healthy again. So means healthy again. But let's learn some other idioms. So to talk about disease and illnesses. So there are some idioms. So how to talk about, for example, when you have start having. Okay, you want to say that. For example, Helen, if you want to say that, I don't know, I've had cold or I have cold and I can't join the class. How to say? The first one is, okay, teacher, I have cold. So it's really normal as, okay. What other phrase or idiom you can use to say that you actually begin having cold?
Uh, I feel blue or
Oh, blue is depressed.
yeah, yeah, it's depressed. Yeah, I
Under the
feel
weather.
I don't feel good, or yeah,
So,
I feel sick. I'm get
yeah,
sick.
yeah, so you can say, first of all, when you say I don't feel good, I think that you're talking about your, you know, mood. So
Yeah.
I'm not good today.
Yeah.
I'm not in a mood, but I'm not feeling well. This is physically. Well is used to talk about your physical condition. So I'm not well means physically I'm not good. Okay. So yeah, of course you can say I'm sick. So I came down. You know that. Come down with an illness.
Yeah.
So I came down with an illness means to begin to have it. Like, for example, I came down with cold. So like, you know, I'm not feeling well. I can't join the class. So this one. Okay, how to say that? For example, I took a lot of medicine to get rid of cold. So how to say?
I came down with the flu, so I need to have some medicines.
Yeah, of course, to get rid of an illness, shake off. Shake of it. To shake off an illness means so I need to take a lot of medicine to shake of it. And so to get rid of it. Well, and now, okay, you trying. So you trying, okay? I could get rid of an illness. So I shook off. Okay, now I'm trying to get rid of it. So the process is fight off. So fight off an illness. To try to get rid of it. So this is the process. So I'm fighting off cold. And okay, now you are better. You could shake a bit and you can say you recover from it. So get over. So get over an illness means to recover from it. Okay, do you want to use them? Do you want to make sentences?
And it have the same meaning of get back on my feet?
Yeah, of course. Of course. Yeah. Yeah, of course you can say. Yeah. And so do you want to use them?
Yeah, I got it.
Yeah, okay, very good. Well, so yeah, as you said, to be back on your feet or to get back on, of course, they're the same. So you can say, well, and now let's keep going with structure. So this is really easy structure. So take me time to do. Take you, take me. Okay, so take and object pronoun and what time, how much time. So for example, it take me 1 hour to, for example, to discuss the issue with my colleague. So it take or took, of course, you can use present, past, future, so you can change the tense, depends on, you know, the condition that you and the time that you are mentioning. And it take me the whole week to recover. It took me the whole week. It will take me. Okay, so could you please use this structure in one sentence and then I will give you another structure?
Yeah, for example, it took me 2 hours to try to my farm
Yeah.
in province. Yeah.
Yeah, of course, of course. So how much time you need to, for example, how much time, I mean, okay, or how long does it take to, for example, go to your workplace from home?
Yeah.
How
Yeah.
much
Two,
time?
2
How
hours.
long? 2 hours. So it takes me about 2 hours to, for example, go somewhere. So it takes me about 2 hours. Okay, well, we have this structure and we have another structure that is take the time to do something. So take the time to do something. So here, okay, again, this is, kind of idiom. So how to say, normally, first of all, it's often used to show you are annoyed because maybe someone didn't do something well or carefully. So you can use this. For example, she didn't even take the time to say goodbye, to spend enough time to do something well or carefully. So you can use this one because they're different. To spend enough time to do something well or carefully. So for example, if you want to do an example, you can say, she didn't even take time to, for example, say goodbye. She didn't care. Okay, just here we can use that because we are actually talking. So she didn't even take the time to say goodbye. So it's like, it's annoying because someone didn't do something perfectly or well. Okay, so try to use it. Now you make sentence using this idiom.
Yes. Um, it it took me um, 2 weeks uh, to uh, to recover from the illness. Yeah.
Yeah, of course. So, of course, it took me 2 weeks. This is take me time. It's okay. Now, the second one, this idiom, because you need to know that they are different. Okay, the use of the second one. Take the time to do something in an annoying way.
Yeah. It take me 30 minutes to make dinner.
It's okay. Again, you use this one. Okay, now the
And,
use of this one. Take the time. Okay. For example, as I told you, it's not the same as this structure. They're different. So it means we use it. We often use it when we are annoyed because someone didn't do something well or carefully. For example, at work, you can use it.
yeah. Uh, they they don't uh, they don't take the time to fix the problem.
Of course, they didn't care. Of course.
Yeah. Okay.
Yeah, they didn't even take the time to fix the issue. Of course, that's really perfect. Yeah, so this way they're different. Okay, well, and any questions?
No.
Yeah, okay, well, so we have a listening, okay, or no. So let's see with advice. Ah, so it's like, no, we need to do this one, I think. Yeah, it's not listening. Okay, so when you have got a headache or a backache, what you do, so it's like, you give me an advice because it's not, I think, uh, where is the last one? I can't see. It's just A, B, C. Maybe one part is left. Okay, so it's okay. So what do you do when you have got a headache? Take some medicine or antibiotics, go to the hospital for an x-ray, and get some rest and drink lots of hot drinks.
Yeah, I think I will choose C. Get some rest and drink
Yeah.
a lot of hot drink.
Yeah. And how about backache? I think we need to go to hospital for an X-ray. This is backache, so it's like
Yeah, backache. So I will go to the
we have
hospital.
to, of course.
I need to see the doctor.
Yeah, of course we have to. And you have caught a cold or the flu, a cold or the flu. So
So yeah, I can first I can get some rest and drink a lot of hot drink,
yeah,
and after that, if uh, isn't better, so I will take some medicine and or
yeah.
antibiotics.
If they don't work,
Yeah, if they don't.
or if it doesn't work,
Yeah,
of course, I will go to doctor. So very good. Oh, you have broken your, what's the question? So of course we go to hospital. So you have broken your arm, like no, just stay home. So of course we go to hospital. So it's like, yeah, funny questions.
of course, we need to go to the
Right, yeah.
hospital.
Yeah, do we have any other option or alternatives? Of course we need to go. Well, okay. Well, okay. So we talked about, you know, physical health. That is really important. But, you know, as you mentioned at the beginning of the session, it's really important to look after our mental health.
Yeah,
But that's really important how. So especially sometimes if we feel really frustrated because we feel like, you know, we get stuck in rut, like, you know, we can't do anything, just, you know, doing the same thing again and again. So, okay, what can we do to make ourselves feel better, you think?
yeah. I
Give me some
think
advice.
we will keep the balance of life. Yeah.
Yeah. So, okay, now you think that, okay, I want to, so I'm asking for advice. Okay, so for example, I'm not feeling good. I'm not in mood, maybe a bit depressed, feel blue. Okay, so what can I do to make myself feel better? To, I don't know, like for example, I don't know, be more energetic, to feel more happy. So, what can I do, you think?
Yeah. First of all, I will ask you what the matter with you. Yeah, and I can give you the suitable advice. Yeah.
Yeah, of course.
If
First
I
of all,
don't know exactly the, the the reason, so I
yeah,
can.
of course. Of course, you know, you need to know what's the problem. Okay. So you think that, okay, for example, I feel like, you know, I got stuck in a rut. Just, you know, go to work, you know, doing my work and stay home, just, you know, like this, for example. So what can I do? Traveling? I
Yeah,
don't know, for
maybe
example.
you need some rest, and you maybe uh, you can take a trip to somewhere. Yeah, maybe.
Yeah, of course. Of course, that's a really good one. Well, so how to give advice? Actually, the purpose of having this question is that, of course, you can say that it's better to do this, but you can also use second conditional. So, if I were you,
If I were you, yeah,
I would,
I
I
would.
would, for example,
Yeah,
travel. I would travel somewhere. I
yeah,
would take a
I would.
trip, for example, somewhere. Okay, so if I were you, you can use, this is one of the uses of second conditional for giving advice. So you want to give advice, so you can use if I were you, especially when someone asks. So I have this problem. What can I do, you think? So if I were you, I would this. After would, you need to use base form over. Okay?
Okay.
Well, and okay, we have a listening. Listen carefully to conversations between a doctor and her patients and answer the questions below. So let me play this audio. Wow. 11.
Unit 6, Recording 4. 1.
Hello, I'm Dr. Andrews. Now, what's the matter?
Well, Doctor, I feel terrible. I get these headaches and I feel sick.
Ah, how long have you had this problem?
A few weeks now, and I can't sleep at night because my head hurts.
You can't sleep.
That's right.
And are you very worried or under pressure at the moment?
No, I don't think so.
Do you have a healthy diet?
Quite healthy.
Do you drink tea or coffee?
Yes, I do.
How much?
Tea? Probably about 8 cups or 10.
A day?
Yes.
I see. And has that changed in the last few weeks?
Not really.
Okay, well, the first thing is I think you should stop drinking so much tea and coffee. Try to drink just 1 small cup a day. I'll give you some painkillers for the headaches. Take 2 of these 3 times a day. I don't think it's anything to worry about, but if your headaches continue...
So about the first one. So what is the problem?
She had a headache and she can't sleep. And the doctor asked, and they figure some reason that she drink too much tea a day.
Yeah, of course.
And the doctor suggests that she should drink one tea per day.
Of course. Well, so when you have a lack of sleep, especially for example, 2 or I don't know, a short period of time, for example, I don't know, you're really busy nowadays, you can't get enough sleep. So you can say I am sleep deprived. So you know that she is sleep deprived, lack of sleep due to some reason. Can be because of your work or I don't know, something else. So you can use this one, sleep deprived. Well, and of course, doctor suggested some. Do you agree with suggestion? I don't think so. Well, okay, and now let's see the next one.
2.
Good morning. How can I help?
Well, I'm worried about my foot.
Your foot?
Yes. It hurts when I walk.
I see. Did you do anything to it? Did you have an accident?
Well, sort of.
What happened?
I kicked a wall.
I see. When did you do that?
About a week ago?
Okay. Did you go to hospital?
No.
Can I have a look?
Yes, of course. Yep.
Where does it hurt?
Here?
Oh, yes, there.
Can you move it?
Yes, a little. But it's very painful.
I think it might be broken. It's nothing to worry about, but I think you should go to the hospital for an X-ray. I'll write you a note, and if you just take this to the hospital...
Well, so what's the problem?
Yeah, he feel hurt with his foot, and he had a small accident some weeks ago, and the doctor advised him to go to the hospital to take the X-ray.
Of course, very good. Well, and now, can you fill in the blanks without listening, or you need to listen again and fill in the blanks? Can you guess?
So, Andrew, now, is it the first or the second one?
So actually from the beginning, I think it's not about 2.
Yeah, the second man. Yeah.
Huh?
Okay. Hello, I'm Dr. Andrew. Now, what the matter? Well, doctor, I have
You.
I'm had headache.
Of course. So what's the matter? Of course. So no, well, doctor, no, she said something else. Just let's listen. It's not bad. It's just beginning. I know.
Unit 6. Recording 4. 1.
Hello, I'm Dr. Andrews. Now, what's the matter?
Well, doctor, I feel terrible. I get these headaches and I feel sick.
Ah, how long have you had this problem?
A few weeks now, and I can't sleep at night because my head hurts.
You can't sleep.
That's right.
And are you very worried or under pressure at the moment?
No, I don't think so.
Do you have a healthy diet?
Quite healthy.
Do you drink tea or coffee?
Yes, I do.
How much?
Tea? Probably about 8 cups or 10.
A day?
Yes.
I see. And has that changed in the last few weeks?
Not really.
Okay, well, the first thing is I think you should stop drinking so much tea and coffee. Try to drink just 1 small cup a day. I'll give you some painkillers for the headaches. Take 2 of these 3 times a day. I don't think it's anything to worry about, but if your headaches continue...
Well, so number 1.
Number 1, now what the matter?
What's the matter? Number 2.
Yeah. Number 2, I feel terrible.
Terrible, of course. Number 3.
Number 3, I get the sick
Headaches because she's got headache. So
headache, and I feel sick.
and I feel, of course, I feel sick. Oh, how long?
How long have you get?
Yeah, have you had? Yeah, how long have you had this problem? And if you
And a few hurt.
a few weeks now.
Weeks.
How long? It's about
how long?
Yeah,
And a few weeks. Yeah.
And I at night because
I can't sleep at night because my head hurt.
Of course.
Yeah.
And doctor, healthy diet. Do you have? Because
you have a healthy diet?
Yeah, and doctor, tea or coffee?
Yeah. Do you drink? Do you drink? Yeah.
Yeah, of course, tea or coffee. Perfect. Well, actually, we have the rest of it. Let's do it. It's okay. Just 1 minute. It's no worries. Okay. No matter. So let's listen to 6.
2.
Good morning. How can I help?
Well, I'm worried about my foot.
Your foot?
Yes. It hurts when I walk.
I see. Did you do anything to it? Did you have an accident?
Well, sort of.
What happened?
I kicked a wall.
I see. When did you do that?
About a week ago?
Okay. Did you go to hospital?
No.
Can I have a look?
Yes, of course. Yep.
Where does it hurt? Here?
Oh, yes, there.
Can you move it?
Yes, a little. But it's very painful.
I think it might be broken. It's nothing to worry about, but I think you should go to the hospital for an x-ray. I'll write you a note, and if you just take this...
Well, so number 1, well.
Yeah. Number 1, well, I worry about my food.
I am worried.
I'm worried.
Of course, about the food. Very good. And number 2, yes.
Yes, it hurts.
Yeah, it hurts when walk.
When
yeah.
I hurt. Yeah.
And number 3.
3, I see. Do you do anything to it?
Just did you, because it's something like past did you? Yeah, and yeah.
Yeah. Did you do anything to it? And Do you have an accident?
Very good.
And the number 5, can I have a look?
Very good.
Number 6, is hurt. Where there is hurt?
Where does it hurt, of course. And number 7.
It's very painful.
Very good. Number 8.
Number 8, I think it's broken.
Yeah, very good. And it's nothing.
And it's nothing to be worried about.
Yeah, of course, to worry about. But I think
go to the hospital for an X-ray.
very good. Perfect. Just about number 4, as I told you, what number 3 and number 4 did you? Okay. Did you do, for example, did you have an accident? Okay, my dear Helen, that's it. And yeah, we need to go now, but it was really good time with you again, and happy to see you again the 1 week. So have a great, fruitful week.
Yeah, thank you. And you too.
Thank you so much. Thank you. Thank you. Goodbye.
Yeah, goodbye, teacher.
Bye.